If you are over 60 and your morning ritual involves a cup of coffee and a blood pressure pill like amlodipine, lisinopril, or losartan, stop and listen closely. You are in the crosshairs of a silent epidemic. Right now, nearly 4 out of 5 seniors are unknowingly battling dangerous side effects caused by the exact medications prescribed to keep them healthy. Imagine your body is a restored heritage home. 40 years ago, the plumbing was flawless. Medications moved through your system rapidly. But as we reach our 70s, that grand house settles. The pipes narrow, the system doesn't clear debris as quickly. Consequently, standard dosages of pharmaceuticals pool up in your bloodstream, transforming a helpful treatment into a toxic burden. Today, we are exposing 5 hidden dangers masquerading as just getting older and giving you the tools to fix them. Comment below, what blood pressure medication are you taking right now? Let's talk about your favorite Sunday activity. Maybe it's a stroll through the botanical gardens. You lace up your sneakers at 8 in the morning, feeling energized, but by late afternoon, like a profound heaviness sets in.
With these laces, you'll feel the difference immediately. Just slide your feet in and tie them up. You'll be comfortable all day.
Your feet feel stuffed with cotton. When you unlace those shoes, you see an alarming sight. A stark, indented ring around your calves, with skin stretched tight over puffy ankles. Many folks over 70 blame summer humidity or natural aging, resigning themselves to buying wider shoes. If your pharmacy label reads amlodipine, there is an 80% chance you are experiencing a chemical consequence. Amlodipine is a calcium channel blocker. It brilliantly widens the arteries, delivering blood down into your extremities. Unfortunately, it completely ignores the veins carrying that blood back up. Gravity takes over, and fluid painfully accumulates in your lower legs. A rushed physician might spot this swelling, or wrongly assume your heart is failing, and prescribe aggressive water pills you never needed. Your action plan: ask your doctor about switching to a medication less prone to pooling. Tonight, try the recliner flush. Elevate your feet above your heart using 2 thick pillows and slowly trace the alphabet in the air with your big toes. This 5-minute maneuver turns your calf muscles into a biological pump, forcing trapped fluid back into circulation. While amlodipine leaves a visible mark, the second medication ruins your days through sound. It begins as a maddening, dry tickle at the back of your throat, a persistent, hacking cough that strikes when sitting in the quiet pews at church, reading to your grandchildren. You might rush for allergy medicines, assuming you inhaled dust. But if you take lisinopril, the true culprit is resting in your pillbox. Lisinopril is an ACE inhibitor. While it relaxes blood vessels, it triggers the accumulation of an inflammatory compound called bradykinin in your respiratory system. Think of bradykinin like a faulty smoke detector. It constantly shrieks and sounds the alarm, even though there is no fire. Your throat is chronically inflamed, forcing you to cough violently even when your lungs are perfectly clear. For an older adult, a violent ending cough takes a massive physical toll. It strains the rib muscles and degrades your quality of life. Worse, it dulls the sensitive nerves in your throat. When eating, your natural gag reflex is compromised, drastically increasing the risk of choking and aspiration pneumonia. Your action plan: throw away the sugary lozenges.
I understand you might be feeling overwhelmed, but together we can work through this, step by step, towards a healthier outcome. Trust me.
Speak to your cardiologist about transitioning to an angiotensin II receptor blocker, ARB. These protect the heart without the bradykinin buildup. Meanwhile, coat your irritated throat by sipping warm decaffeinated tea, mixed with raw honey and cinnamon, before bed. Our first 2 medications give clear warning signs. The third is a silent operator that masks its damage completely. Your kidneys are the bedrock of your internal health. Much like the concrete foundation of a house, they endure immense pressure, working relentlessly to filter toxins. Completely unseen. Because kidneys lack pain receptors, a patient taking losartan might feel incredibly vibrant, wholly unaware that their filtration system is crying out for help. Losartan provides long-term protective benefits, yet it carries a profound paradox. During the first few months of use, or during a hot summer when you become mildly dehydrated, it can drastically reduce the blood pressure specifically within the kidney's microscopic filters. Imagine turning the water pressure in your home down so low that the kitchen sink barely trickles. If you are a senior who naturally experiences a diminished sense of thirst, this drop causes the biological filters to stall. Adding this sudden drop in pressure can result in silent, irreversible damage before your next check. Rely on hard data. Demand your physician orders a glomerular filtration rate (GFR) blood test 2 times a year. Furthermore, transform your diet. The classic Western diet is loaded with kidney-destroying sodium. Swap out the salt shaker for bold, salt-free flavorings. When grilling salmon or roasting chicken, marinate it in extra virgin olive oil, fresh lemon zest, cracked pepper, and dill.
I've walked many tightropes in my life, but this one feels different.
Even if you navigate the side effects above, one sudden movement can erase all your hard work. Picture this, it is 3 in the morning. You awaken with a sudden urge to use the restroom. You toss aside the duvet, swing your legs out of bed, then stand up abruptly. Instantly, the room spins. Your vision narrows into a dark tunnel. Your ears ring, and you frantically grasp the edge of the dresser to prevent a disastrous fall. Medical professionals call this orthostatic hypotension. When you were 30, baroreceptors in your neck were sharp. The second you stood up, they constricted blood vessels, shooting oxygen-rich blood straight to your brain. However, as we age, these sensors become sluggish. Compound that slowing with medications designed to open arteries, and those sensors become paralyzed. Standing quickly allows gravity to drain blood from your head into your legs, causing severe dizziness. This is a leading cause of fractured hips. Your action plan: implement the 15-second rule. Keep a glass of water on your nightstand. Upon waking, drink a few large gulps to instantly boost blood volume. Sit upright on the edge of the mattress. Plant your feet firmly on the carpet and count slowly to 15. Wiggle your toes. Give your body's delayed sensors the time they need to catch up. Those 15 seconds are your ultimate defense against a life-altering fall. You know how to prevent a devastating fall, but the most chaotic risk might be sitting right in your kitchen pantry. Take a close look at your daily pill organizer. Alongside your prescribed blood pressure medication, what else are you swallowing? An over-the-counter pain reliever for an aching back. Potassium supplement because a television show said it was excellent for the heart. In modern Western culture, we are conditioned to believe more pills equal better health. For a senior citizen, this creates a toxic battlefield inside the liver. When you force an aging digestive system to process 6 different chemicals simultaneously, the factory shuts down. Worse, these seemingly innocent pills begin to fight each other. Taking amlodipine alongside certain cholesterol drugs drastically increases the risk of severe muscle breakdown. Mixing losartan with everyday over-the-counter pain relievers acts like a sledgehammer to your kidney's fragile filters. Most terrifying of all, combining lisinopril with a seemingly healthy potassium supplement can cause your blood potassium levels to surge rapidly, triggering a lethal, instantaneous cardiac arrhythmia. Your action plan: perform the shoebox audit. Tomorrow morning, grab a large cardboard shoebox. Place every single item you ingest into that box: prescription bottles, vitamins, herbal sleep aids, joint supplements, and pain relievers. Bring that heavy box to your next doctor's appointment. Place it squarely on the examination table and ask, "Please review everything I am taking. Are any of these compounds reacting dangerously with each other? What can we safely throw in the trash today?" This single bold act of transparency can literally save your life. Today, we mapped out the hidden terrain of your aging body. We exposed the invisible ankle weights of amlodipine, the dusty attic cough of lisinopril, the silent foundation risks of losartan, the vital 15-second rule to prevent falls. and the absolute necessity of the shoebox audit. Your body in its 70s and 80s is a magnificent, enduring masterpiece. It does not need to be bombarded with endless handfuls of conflicting chemicals. What it truly requires is fine-tuning, close observation, and a profound respect for how its intricate machinery has changed over the decades. Having the courage to advocate for yourself, question your current prescriptions, and eliminate unnecessary noise is the truest path to a vibrant, independent, and fiercely joyful longevity. If this deep dive gave you clarity today, hit the like button and subscribe to catch next week's video on the 5 warning signs of a hidden stroke. And share this with a friend who needs to hear it. Stay vigilant, stay healthy, and I'll see you next time.